Hi friends, today we are in the peak of the second wave of COVID-19 disease, and in this peak we are seeing many patients getting into hospital and some are not getting the bed. Those who got the bed, sometimes they are not getting the oxygen. There is shortage of oxygen, there is shortage of the antiviral medicines used for this disease. And yes, all of us are having an emergency situation or a medical emergency situation. All of us are suffering. The healthcare system is at its peak, but more than that, we are seeing good number of our fellow citizens are dying. But all this can be avoided by taking the treatment at the early stage. This COVID-19, especially in the second peak, we are seeing patients coming with body pains, fever, loss of smell, loss of taste or change in the taste, cough and diarrhea, loose motions. Some are coming with skin rashes, redness of the eye and cough with expectoration. Phlegm is coming from the lungs, and usually after 7 days, they are developing low saturation of oxygen. This is called hypoxia. Any oxygen saturation measured with a finger pulse oximeter less than 95 is considered low. Now, initial 1 week there will be viremia and you will see all the symptoms except the cough and expectoration, breathlessness, shortness of breath, chest tightness. In that phase of viremia, you have to start the medication, and if you start the medication at an early stage, they probably may not require a hospitalization. What we have observed is some patients having fever, body pain for 1-2 days or loose motions for 1-2 days, they are getting the RT-PCR test for COVID and which is coming as false negative. Means some patients, especially 40% of the patients of COVID disease are showing a negative result, and this is a known fact. So if you are having the symptoms in this peak of corona disease, COVID-19 disease, even though the RT-PCR test is negative, you have to consider it as positive and you have to start the medication. Some patients, as I told, in spite of having the symptoms, when their test became negative, they are not using the medication thinking that this could be a typhoid disease or this could be a dengue fever or a simple viral fever or a general tiredness, and they are not taking the medication. These people in the second week or third week landing in infection or damage of the lungs. At that time, they are having hypoxia, cough, breathlessness, shortness of breath, chest tightness, and suddenly they are requiring ventilatory support, and majority of the people who go on to the ventilator are not coming back. So all this can be avoided by starting the anti-COVID medication as early as possible. Those who have started the anti-COVID medication in the first week, most of them they don't require hospitalization or oxygen. What to do when you identify the COVID-19 disease? Consult a doctor who is an expert in this COVID-19 treatment and take the combination of the medications like favipiravir, azithromycin, ivermectin or colchicine and budesonide inhalational method like nebulizer of the budesonide or an inhaler of budesonide. When you take these medications in the early phase, the viral replication is arrested in the body. When the viral replication is arrested or at least reduced, the body can fight out the virus disease. But if you don't do this, the number of virus particles in the body increase phenomenally, and also you will be suffering with the disease, and also you will be spreading the disease to many people. To avoid this, as soon as you have the first suspicious symptom of COVID-19, get isolated at home, take the medication as per the doctor's advice, check the pulse oximetry every 2 hours, and if it is below 95, you should report to your doctor or reach the hospital. And whenever your saturation comes down, it can be increased by doing breathing exercises. Breathing exercises are very simple. Take a deep breath in as forcibly as possible and breathe out as forcibly as possible. After that, try to sleep in the prone position. That means sleep on your abdomen for as long as possible during whole day, whole night, if possible. When you do this, the mismatch of ventilation and blood flow in the lung fields is corrected and is in the favorable position, and your oxygenation will improve by 4 to 5%. So even if the oxygen saturation comes down to a dangerous level of 90%, by following these things, your saturation can improve to normal levels. Then you don't require oxygen and you may not require hospitalization. To do the breathing exercises, you can use a 3-ball incentive spirometer. It will help you and guide you to do the breathing exercises. And after following all these things, you should not spread the disease to your family members. For that, all the family members and including you must wear N95 masks. Fortunately, these N95 masks are freely available today and you should use them except during your lunch or breakfast or dinner. Whenever you are eating, that time you have to remove the N95 mask. So ideally, you should not have the food along with your other family members. If you follow all these simple tips, you can come out of this deadly COVID-19 disease. And remember, the second wave of COVID-19 disease is more deadly than the first wave, and it is more infectious, and disease is progressing very rapidly and taking the life. So all this can be stopped, arrested very easily by taking the early treatment, following the home precautions, and don't spread the disease to others, especially your family members. Thank you. Stay safe.